about 90% of people will have back pain at some point in their lives. So as long as there's gravity and we're walking on our feet, we're at risk for having back pain at some time. Lumbar epidural steroid injection is the procedure, and it's typically for patients that have back pain related to either degenerative disc disease or spondylitic change, which is degenerative change of the bones in the back. A lot of times with those problems you have what's called spinal stenosis, or narrowing of the canal in your back that holds all the nerve roots. And what the procedure allows us to do is put some medicine, some steroid and a numbing medicine into the epidural space, which is a space right outside of the nerves. So if the nerves are being compressed or if the nerves are inflamed from a disc herniation, we can get the medicine right where it needs to be, and patients get pain relief and potential for the herniated disc to shrink down over time. We usually have some sort of imaging on the patient. Either we start with an x-ray. A lot of times patients already have x-rays, and then we like to get an MRI just to get a lay of the land and see where most of the disease is, most of the spinal stenosis or nerve compression is. Once we figure out where the problem is, we're able to put the medicine in the right spot. The patients usually come and we get them on a fluoroscopy table on their belly, mark a spot on the skin, and use the x-ray machine to guide us and show us where the needle needs to be. Put the needle into the epidural space and confirm it, and once it's in the right spot, we put the medicine in. Needle comes out, and the patients usually stick around for about a half hour after the procedure, and as long as there's no problems, they can go home and take it easy the rest of that day, and then the following day resume their normal activity. The procedure itself is not a painful procedure. We use local numbing medicine to get the needle in place, so patients tolerate it very well, and like I said, they go home about a half hour after we're done. So yeah, a lot of patients are surprised because they feel so good so quickly. Well, this procedure, we offer it typically the same day it's requested. If not, we can get it done the following day, and that's a great service. A lot of the pain management services in town will have you wait for anywhere from 1 to 3 weeks if you want to get an injection like this. So we pride ourselves on quick service, getting patients feeling better rapidly. We can do this procedure up to 3 times in a year, and so some patients will get it spread out. Get one done, and then maybe a couple months later get another one done, and to avoid surgery. Surgery is typically the last resort. Either you've had back pain before, or you know somebody who's had back pain, and it's not a pleasant thing. So we like to get patients feeling better.